coronary angiograms, angioplasty, and bypass surgery. In plain English, the way he keeps her heart beating strong. Please join me in giving a warm welcome to the handsome Dr. Tim.
Thank you. Sample pictures na nakikita namin sa angiogram. You can see that on your left, there are actually two arteries. Meron sa taas, meron sa baba. Those are the two left-sided arteries. And you can see the two left-sided arteries arise from one big artery. The big artery is the left, and then anterior descending, or kung nakapagpa-angiogram na kayo, maririnig nyo, LAD. LAD is left anterior descending. Or LCX is left circumflex. No? So LAD, left anterior. Anterior is the word for front. Descending is the word for going down. So the one that goes down the front of the heart is the left anterior descending. Circumflex is circumnavigating the left side. No? So left circumflex is the one that goes to the left. So the left circumflex and the left anterior descending come from one artery. But the right is only one artery. And the right, you can see on your right, is shaped like a big letter C with two tails. So that's a typical appearance of your arteries. And these arteries in this particular patient are normal. Wala kang makikitang bara. Right? So paano malaman may bara? Siguro naman, kitang-kita nyo sa araw, naging mas makipot yung daanan. Lumipis, di ba? Yung column ng itim, malawak siya. Yung itim, yun yung dye. So, pag yung ugat mo, malawak din yung dye. Pagka kumipot yung ugat, magiging manipis din yung dye. Tapos, pag naging normal ulit yung artery, magiging malawak siya ulit. So you can see where the arrow is pointing, the passageway of dye becomes very narrow. So this is a narrowing in the left anterior descending artery. This is a narrowing in the right coronary artery. The right coronary artery, sabi natin kanina, parang isang malaking letter C. Sa gitna ng letter C, makikita nyo, naging manipis siya. Right? So, what do we do when we find blockages? There are three ways to treat artery blockages. One is with medicine, the other is angioplasty, or and stenting, and the other is with bypass surgery. So, sinong bagay sa gamot? Sinong bagay sa angioplasty? Sinong bagay sa bypass surgery? Kung yung blockage natin less than 70%, gamot yan. So, at home angiogram, hui kun tat go 70%, gamot yan. So, ang tanong, anong level ng blockage bago nagiging risky for heart attack? Actually, law of physics yan eh. Sabi ko kanina, di ba, tubero ako? No. Kung merong water pipe, kinalawang ng 10%, pagpunta mo sa banyo, binuksan mo yung gripo, sa tingin nyo, normal ba dali ng tubig o hindi? Normal pa, 10% lang, di ba? Kung 20%, pwede pa. 30%, pwede pa. Oh. May premyo ba to? Sino magdodonate ng price? Pag 50%, actually, at 50% by law of physics, you will not know. You will not know. Why? Because before the blockage, there's buildup of water pressure. The buildup of pressure is enough to push water through so that when you open the faucet, you don't know that there's a 50% blockage. So the question is, at what point does a tube carrying a liquid with blockage will compromise flow? The answer is 70%. So, kung dumating na ng 70% yung blockage sa ugat mo, kulang na sa dugo yung puso mo. You are already at risk. So, anything less than 70%, gamot yan. And as long as we can keep the blockage less than 70% with the medicine, hindi na siya magkakaroon ng heart attack. Diba? Now, kung meron kang blockage na more than 70% pero nasa maliit lang na ugat, nasa sanga lang, a branch, that only supplies a very, very small area of your heart. Let's say it only supplies 5% of your heart. Even if that artery all of a sudden blocks, you will not die. So, nakita niyo yung mga itsura ng arteries kanina, di ba? Balikan natin yung iba. Kunyari, itong nandito sa left side, para siyang punong nakabaliktad. It starts with the bigger trunk and then it develops branches and becomes smaller and smaller. So, imagine natin may puno lumabas dito sa harap natin. Naputol yung isang sanga doon sa taas. Ano mangyayari sa puno? Wala. Pero pag pinuto ko yung puno sa main trunk, patay buong puno. Right? So if you have a 70%, 80%, 90% blockage in a small branch, we don't do anything. Medicine pa rin yan. So the only time that we need to do more is when the blockage is more than 70% in a large artery. Okay? So paano ginagamot? Alam natin na pagka may blockage, pwede magkaroon ng blood clot. Kasi yung daloy ng dugo doon mas mabagal. Ang dugo, pag hindi gumagalaw, namumuo. Right? So ngayon, inside all of our bodies, blood is constantly flowing. It's not really clotting. But if I cut myself and a small drop of blood falls on the table, in 5 minutes it's clotted. So blood that does not move can clot. And if you have an area of blockage and the movement of blood there is slower, you can form a clot in the blockage. And if you form a clot on top of that blockage, the flow of blood will become blocked and you'll have a heart attack. Which is why blood thinners is a mainstay of treatment. And napag-aralan na to, if you give something like aspirin or clopidogrel, a lot of you know it as Plavix, to people who have blockages, the chance of developing a stroke and the chance of developing a heart attack is lessened by almost 50%. So kung ang chance ng heart attack mo dati 50%, ngayon 25% na lang. Just by taking a blood thinner. Right? And then, kung ang blockage mo ngayon 50% pa lang at hindi mo gusto maging 70%, lahat ng pwedeng mag-cause ng pag-worsen ng blockage, gagamutin mo. We already mentioned that a while ago, and it's just as a review, because people sit in front of me and I tell them the information, but they ask the question again. Minsan hindi nagsisink in. Paano ko iiwasan yung paglala ng blockage ko? We have to control all of the things that causes blockage. Babalik tayo sa basic, blood pressure, sugar, cholesterol, bad cholesterol, mababang good cholesterol, triglycerides, smoking, family history. So, some of these things, wala tayong magagawa. Kung ako, pamilya ko, mataas ang heart attack, hindi ako pwede palit ng pamilya. Or kahit magpalit ako ng pamilya, dala ko pa rin yung lahi ko, di ba? So, we cannot outrun our genes. We cannot change our gender. Before menopause, men are more likely to have heart attacks and strokes than women. But women cannot also avoid menopause. Pareho na tayo. Age, we also cannot change. We're all growing older. So all those are problems. And smoking is a big factor. So we usually have to check serially. So kung nakita natin ngayon na meron kang 50% blockage, next year we will perform some type of test. Either a stress test, some people CT angiogram, CT may angiogram, but we will only do another angiogram if there is evidence na nag-progress siya. No? Without any evidence, we will not do anything. So, angioplasty or stenting and bypass, usually ginagawa natin yun pagka more than 70% ng blockage. The blockage has to be in the big artery. Sinabi natin kanina, if it's in a small artery, we will not do anything. So we will do something if it's a big artery. And some people kasi may heart attack na dati. Kung nagka-heart attack na sila dati, that portion of the heart na nagkaroon ng heart attack, unfortunately, is permanently damaged. So kahit i-angioplasty natin yung ugat nun, at maging normal yung daloy ng dugo, hindi na siya mabubuhay uli. So kailangan na yung angioplasty na ginagawa natin, o yung bypass na ginagawa natin, makakatulong sa pasyente. We need to make sure that that area is not only viable, but salvageable. No? And then of course, dapat yung pasyente, good quality of life. Kung yung pasyente na-stroke 10 years ago, bedridden for 10 years, tapos nakita natin may evidence ng blockage, yung pasyente na yun, sasabihin sa akin, Tim, patayin mo lang ako. Hindi na sulit ang buhay ko, tapos bubuhayin ko pa siya sa angioplasty. Parang it doesn't make sense. No? And then some people have stage 4 cancer or terminal illnesses. May mga may AIDS, HIV, baka hindi na sulit. Some people, kung masyadong maraming blood clot, napatunayan, pag maglalagay tayo ng stent, the chance of the blockage coming back in an area of clot is much higher. And then some people, sobrang daming blockage, gagamitin na natin na stent, 12, 15, 18 stents, hindi na siya practical. Diba? Not that it cannot be done, but Pag ganun na kadami, we have to think about other alternatives. And then some patients have blockages in areas of branching. So may malaking ugat, naghihiwalay sa dalawang malaking ugat, and all of those branches may bara, mas mahirap siyang gawin. Not impossible, but harder. But if you have multiple blockages in multiple branch points, and all of them are very important, it becomes technically very demanding for us to do. And each of those branch points have a slightly higher than average chance of coming back. And mathematically speaking, if you have 3 or 4 different branch points, all of them having a slightly increased chance of recurrence, then the chance of recurrence of at least one of them. So in these patients, sasabihin namin, Mr. Juan de la Cruz, may pero angioplasty, so sorry, I think you have to consider bypass. So that's why bypass is still being done in 2025 kasi hindi lahat ng blockage nabubuksan. And how do we do bypass? So, pag meron kang traffic sa kalsada because maraming basura, you can fix it in 2 ways. First way is, pwedeng tanggalin mo lahat ng basura para lumawak yung daanan. That's what angioplasty does. Bypass, hindi niya gagalawin yung traffic sa baba. Gagawa lang siya ng overpass. So a lot of people say, sa bypass pa, tinatanggal yung bara? Hindi na. Hindi na kinukut-kut yun. You can see the blue lines are bypass arteries that are being used for patients. So yung mga blockage doon sa gitna, hindi na siya ginagalaw. Wala tayong pointer eh. No? Ay, meron pala. Yeah. So ito yung mga blockage. Ang normal na daanan pababa rito, imbis na dumaan dito, nagkabit sila ng panibagong daanan. No? Ito sa right artery, itong letter C, may blockage dito. Instead of doing angioplasty in this area, nagkabit sila ng parang overpass. So that's bypass surgery. But bypass surgery most of the time is open heart surgery. Bypass surgery nowadays can also be done minimally invasive. For the surgeons, however, mas mahirap gawin yun, even though for the patient, the recovery is faster. And we can do it minimally invasive. So basically, we are creating alternative or new passages for blood flow. It is tried and tested. So hindi pa nagagawa angioplasty, surgeons natin. 1960s, 1970s pa lang, nagbabypass na sila. And it's riskier than angioplasty kasi surgical siya. The risk of angioplasty is less than 1%. The risk of bypass, even in very young people, is 2 to 3%. So kung sabihin natin 3% tapos less than 1%, 3 times the risk siya. But you also have to realize if you need bypass and your risk is only 3%, actually, mathematically speaking, the chance of success is still 97%, right? And for a life-saving procedure, a 97% chance of success is pretty good. And dito sa mga pasyente pinakita ko kanina, mga may calcium, may blood clot, branch points, left main, mas longer ang bypass kaysa sa angioplasty. But in an artery that has a very simple than bypass. So, sino yung angioplasty natin at sino binabypass natin? So, some patients will ask, Doc, si Juan de la Cruz, na-angioplasty mo, bakit ako hindi? Iba naman ang blockage, no? So, to summarize, coronary artery disease or blockages in the heart arteries is actually very common. Nagpapalitan lang ang tatlo as top killers in our country. Heart attack, stroke, and cancer. Heart attack is coronary disease. This year, it might be heart attack. Next year, it might be stroke. Next year, it might be cancer. These 3 are just changing. So, parating top killer siya. It can be asymptomatic. So, a lot of you who don't have symptoms, you may have coronary disease but don't know. It can be caused by a lot of the usual things we see. Blood pressure, sugar, cholesterol, smoking. We usually find out with testing, unless somebody comes in already with a heart attack. And we have to confirm this with an angiogram. And if it's confirmed to be less than 70% blocked, usually medicine. If it's more than 70% in the big artery, usually we have to do something else, either angioplasty or bypass surgery. So, as people who are not in the medical field, what can you do to try to avoid it? No? you have to have yourself tested. There's so many people here, it's impossible na walang may heart disease dito. Sa dami natin, it's impossible. There's going to be people here who have heart disease. Paano ko malalaman? You have to allow me to test. If I do not test, I cannot find out. You could be having heart artery blockages but not feel anything. You have to check for the causes. Some people may high blood, they don't feel anything. Some people may diabetes, di nila alam. May mga iba, nabuhay na ng 70 years, never pa nagpa-blood test. Yung iba, nabuhay na ng 70 years, wala pang ECG. So how would you even know if you have diabetes or cholesterol? Because all of these cannot be felt. Now, if you have symptoms, lalo na may chest discomfort na kayo, nahirapan na kayong huminga, hinihingal kayo, huwag na kayo magantay. Kailangan magpa-check na kayo. Kung wala naman kayong nararamdaman pero gusto nyong malaman, kailangan magpa-check din kayo. We cannot rely on what you feel. Ngayon, usually, we would finish the examination with a stress test. Kunyari, may pumasok sa hospital, puputok na yung gallbladder, hihingi sa akin ng clearance. Madali ang stress test yun. Pagpasado, cleared na kaagad yun. So that's the easiest way for us to find out stress test. Ngayon, pag stress test abnormal, or yung is talagang very, very consistent with blockage, the next step is the angiogram. Right? And then depending on the angiogram, it's either medicine, angioplasty with stent, or bypass. After all of that is done, kasi pag may new patient, ang number one goal ko is to find out, is this patient in front of me at risk of having today? I'll do those tests. Kung napatunayan na pasado siya, I shift to plan B. From short term, magiging long term. Now, if sa examination ko, nakita ko na nasa panganib siya ng heart attack, I have to find ways of eliminating that risk. Kung napatunayan may blockage siya, kailangan mabuksan ko yung blockage para matanggal siya sa panganib. Pag natanggal na siya sa panganib, we go now to long term. And what is long term? Long term means we want him to be free of a heart attack and stroke 5 years from now, 10 years from now, 15 years from now, 20 years from now. Ibig sabihin, gagawin natin lahat para maiwasan yun. So if a 50-year-old comes in today, nakita kong may blockage siya at in-angioplasty ko siya, at wala na akong gagawing iba, magkakaroon na siya ng blockage ulit. Kasi yung katawan niya, gumagawa na ng blockage eh. 50 years old na, may blockage na siya. Kung babalik lang siya sa ginagawa niya dati, blockage siya ulit. Diba? Kung ako, may kotse ako, kaskasero ako, nasira yung kotse, dinala ko sa mekaniko, kahit yung pinakamagaling na mekaniko, inayos yung kotse. Kung kaskasero pa rin ako, ano mangyari sa kotse? Sira uli, di ba? Kailangan magbago ako. So, kailangan may magbago sa pasyente. Otherwise, magbablock siya uli. So, now we go from removing a life-threatening situation to now maintaining him in a safe place by ensuring that all of the risk factors, the blood pressure, the cholesterol, all of these are controlled. And then performing yearly annual general examinations, including a stress test. And as long as those are normal, the patient is usually good year to year. Thank you very much.
And now, may we call on stage again Dr. Hilda Ong to moderate our Q&A. We encourage everyone to please ask questions to our second speaker.
The package for angiogram in Chinese Gen is 66,000. 66.
66,000. So, angiogram,
Baka ano na kasi siya eh, baka pa discounted na siya. So baka yun na yun.
baka yun na.
Parang calculated na. I can find out kung may bawas pa. No?
Okay, my last question. Doctor, bakit yung mga angioplasty hindi tumatagal ng 10 years? Yung iba, 3 years, 4 years lang.
Actually, that's a misconception. I have many patients na na-angioplasty ko between 2000 and 2005 when I started my practice na hanggang ngayon, okay pa. Uuwi tayo dun sa sinabi ko kanina. Pagkatapos ma-angioplasty, paano inaalagaan ng pasyente yung sarili niya? Kung regular siya sa check-up, regular siya sa gamot, blood pressure, parating control ng sugar, parating control ng cholesterol, tumigil sa paninigarilyo, yung chance na magkaroon siya ng panibagong bara, o yung chance na magkaroon ng bara dun sa area na na-angioplasty natin actually mababa. Yeah. 90% of most people who have standard angioplasty will last more than 10 years. Okay po.
我是要问講這樣咧，醫生這樣 heart irregular heartbeat 度是有危險嗎？無危險啊？
所以心率搏無順也最寬，有嘅危險，有嘅無危險，所以要看看什麼款嘅 irregular heartbeat。所以那是較早搏呢叫做 premature beat，佢嘅對死命無危險。好，所以 irregular heartbeat 意思是說心率搏個通常是叫篤篤篤篤 ，irregular 是篤篤篤篤篤篤篤。但是佢嘅是較早搏呢，佢嘅對死命無危險。但是有嘅 irregular heartbeat 就對死命危險，所以較常是調合心電圖，還是創行嘅24小時 holder 印出來，咱才會知影看到底有危險啊無。
我都逐擺有咧通心電圖啊，
所以
然後要去睇醫生。
所以心電圖個好就拄前有 irregular heartbeat 掠到，咱才會知影，因為 irregular heartbeat 24小時有。所以你若合心電圖拄前咧合嘅時陣，你無 irregular heartbeat，真係是袂掠到。
有危險嗎？無危險啊？
你心電圖互我看，我走我當識。所以嗰一個問題，我都問你個嗬，你 irregular heartbeat 偌久咯啊？
幾多年啦呢？
如久哦，如久你人也個啲咧，我如無危險啊。
多謝。Kapag inatake, takbo na. Kasi meron PhilHealth. Ngayon, another question. Paano, Hilda, kapag wala akong contribution, no problem. As long citizen, covered, even wala kang contribution, sasagutin ng PhilHealth. Okay?
Bad news lang yun sa misis ko. May emergency ka na naman. Hindi ka naman ganun ka-busy dati. Kaya kasi ngayon, lahat pwede na i-angioplasty. Dati kasi, may mga dumarating sa ER, sasabihin namin, ang gastos mo, 500,000. Ay, wala kaming pera. Matera lang sila. Pero ngayon, lahat ng dumarating na may heart attack, tatawagin na ako. Hindi na ako hihindi, di ba? So, mas madala na ako. Sasabihin ng misis ko, saan ka pupunta? Hindi ko punta sa hospital.
Marami na mga heart attack. Kung sakali, wag naman. Marami na tatakbo sa'yo kasi may PhilHealth na.
Ay, sasagutin natin sila. Tutulungan natin sila as much as possible. Yeah.
Yes, and then kanina, Doctor, you have mentioned na 30% suddenly nakakaroon ng heart attack. Na wala silang nafe-feel, normal, akin na lang, sabihin natin, EG, echo, lahat normal. Doc, my question is, para manigurado lang, pwede ba ako magpa-angiogram dahil normal lahat ang test ko?
Yeah. So, ito yung tinatawag natin patient. Ang sasabihin na namin sa pasyente, naka-stress test na nga siya. Normal na nga ang stress test. Sasabihin namin sa kanya, hindi mo na kailangan ng angiogram. Pero sasabihin nila, Dok, sigurista ako eh. Ayoko ng 95%. Paano yun? Ako sa 5% na nagkamali yung stress test. Sinasabi ng stress test, wala akong para. Yung pala, meron. So yung mga ganun, wala na tayong kawala. Kung hindi sila makatulog sa gabi dahil dun sa 5% na yun, angiogram lang natin siya for peace of mind. Diba? So we can do it on patient request as long as patas tayo sa patient. We will tell the patient it is not recommended. But if you want it, we can do it.
CI officers for the photo opportunity of awarding of plaque of appreciation. Dr. Timothy B. for raising the October Health guest speaker on the topic of angiogram, angioplasty, and bypass. Thank you for being a part of our participant health picture. Again, a round of applause to Dr. Timothy B.